This message goes out to Dr. Janet Fitzgerald, Minister John Hagee, and our Premier, Andrew Furey. Since, I guess, January, you've been telling everybody that we're all going to get COVID and that we should expect to get COVID. But what you're not telling them is that the policies that you have in place and the safety precautions that you're lifting are what's going to give everybody COVID. You're telling people that they must assess their own risk without giving them the proper baseline. There's nothing to do to protect your risk other than stay in your own home and see no one else ever. If that's what you're saying, is that we're responsible for our own risk. I've not seen friends. If I see a family member, it's with a mask on or taking rapid tests ahead of time for safety. Rapid tests that I have to pay for out of my own pocket, of course. I contracted COVID in early 2020 at work, an illness that was going throughout my building, and I asked public health to look into it. I asked to be tested, and I was refused. Now, after 2 years, I've been doing everything in my power to not get sick. I'm not working this year. We don't go in restaurants. We don't go in grocery stores. We go nowhere. You ask anyone in town who has a private business, they probably know me as the curbside pickup person, because I'm supporting local. I'm still doing that. I'm just not spreading COVID. And my husband went to work for the entire week after you changed the guidelines that people who have positive COVID family members, so people in their house, close family contacts, are known to have COVID, and you're telling them to go to work and school. So my husband went to work with one of those people, and he brought COVID home. He doesn't take off his respirator, but it's not a fit tested one, so I guess that's how we got it. But if somebody has their mask off 20 minutes before they invite someone into an office, it's already in the air. We assume that everybody has the same knowledge to make certain decisions, but not if they're not told. And that's your job. Your job is to tell them. So now I have COVID, and my family GP knows that I've been suffering from long COVID for 2 years. I see a neurologist, I've seen an endocrinologist, I've seen an allergist, I've seen a dermatologist, an ENT specialist, a hematologist. We're still trying to figure out what's wrong, but one thing we do know is that all my symptoms lead to inflammation, which we know can be extremely dangerous with COVID infection. I have ongoing inflammation for 2 years, causing a lot of the neurological issues. I also have some bruising that is new, and the hematologist is trying to help us out with that. But according to the minister's office and Cheryl Foo at the Health Sciences Center, people with long COVID are not considered immunocompromised or at risk to further damage from the virus. So, post-COVID condition is not considered to be an illness that would put you more at risk for more COVID infection. Just take a moment and let that sink in. I was a healthy, active, sociable individual. Now I stay in my house. I go for walks. I can't run. COVID took that from me. I might not do it to everybody, but on a conservative number, it will do it to 10% of all the population. So if everybody in Newfoundland gets COVID, that's over 50,000 people who will no longer be able to be physically active. So my GP has been trying to get Paxlovid antiviral medication for me based on my medical background and what he knows about post-COVID condition, because in all honesty, he knows what he's had to read and it's not talked about here. So Minister Haggie's office and Cheryl Foo at the Health Sciences Center made the final decision yesterday on day 4 of symptoms for me that I would not qualify because we don't know enough about long COVID. We know it's multisystemic. We know it causes organ damage. We know I already have that. But because they don't have all the answers, they won't prescribe me a medication known to safely stop replicating a virus that we already know has caused so much havoc on my body. Today's the last day that I could get prescribed that antiviral. Why such a hold on it?